In this video, we're going to discuss, is chiropractic care safe and effective? How's it going, guys? Dr. Chris Sovey back with another episode of Working Body Wednesdays. Now, you may assume based on the title of this that I'm going to be very biased about my opinion on this. Whereas I work with several chiropractors and I've been very pleased with their results. And it's important to clarify that safe and effective are two very different things. And I think that a great chiropractor can be both of those. Now, just like physical therapy, the approach of treatment in chiropractic care can vary wildly. A certain clinician may focus on high velocity thrust manipulations exclusively. Some may use techniques like muscle energy or other types of lower amplitude movements that don't require such a velocity involved in their movement. And so to clump, I'm not trying to make a clickbait video here, and I apologize if it seems like that, but it is important to delineate some of the differences between types of care, and you're not going to know that until you research the chiropractor further, or you spend some time seeing how they assess and treat, or reading about them, or hearing from another patient who's seen them. So I do think that chiropractors can be safe and effective if you are screened correctly. So if somebody's going to use, let's start here, if somebody's going to use a high velocity thrust where you're taken into a position and a quick thrust to the neck, it often feels good for many people and can clear up things, but they should be specific and they should be certain to rule out anything that could cause a stroke, which are pretty rare, by the way, in cervical manipulation of the neck. But we need to be sure that you don't have any history of herniated disc, osteoporosis, active cancers or infections, things of that nature that could cause some serious complications. I do want to say as a sidebar though, if you're seeing a chiropractor that's still doing a complete rotational thrust like this, that's a very general manipulation and it's old school and you're at higher risk for a stroke in that case. So that's one of those gray areas where the literature kind of goes back and forth and is not very clear, but this is the highest risk position for tearing the vertebral artery if done at a thrust end range position. This could happen just by leaning your head back over a sink at a hair salon, that kind of thing. That we've seen that with people, but the thrust manipulation in this type of position can be worrisome sometimes. So be sure that they're using the newest techniques. Some people are using things like Gonstead is a type of technique where if you're doing a thrust manipulation, it's not purely rotational and you can take the rotational component out of that. So we're not tearing that vertebral artery. And so I'm just giving that as an example. There thrust manipulations in the thoracic spine, the mid-back, are usually very safe in most cases, again, if people are screened properly, and the low back as well. However, if you have some of those risk factors, it may be prudent to talk to them and make sure that they're going to use techniques that aren't high velocity. There are several different approaches to manipulation that people can take that don't involve a thrust. Now, effective, absolutely, in the short term or in the long term, if they are following that up with corrective movement. So if you have an area in your spine or in any of your limbs that is manipulated, if it's not followed up with corrective movement or appropriate strengthening and stabilization, then it's very likely that you're going to go right back to that pattern. If you always have the same area of your spine that's repeatedly manipulated and it always goes back to the same way, that tells you something. There's either an area that's moving just solely too much and areas around it that aren't moving enough, or some of your lifestyle things, whether it's sitting or sports or other activities, are influencing that to go back the way that it is, and that joint or the surrounding joints don't have the stability and the motor control, your ability to control movement and position of joints. So that needs to be addressed, or you're going to continue to be manipulated your whole life and it will never really get any better in the long term. So make sure if you are seeing a chiropractor that they are addressing those kind of things as well, or you are referred to a physical therapist, somebody that specializes in some of those movement disorders and can help you. And that's why I like working together with several different professions. There are chiropractors that can do certain manipulations much better than I could, and I'm happy to refer out to them in order for them to do some of those things. And then you can work together between professions in order to get the better results that you want. I'd love to hear what your experiences have been with chiropractors. Have you had good or bad results? How long have you been with your chiropractor? Have you improved in the long term? That's what I'd like to know is, have some of these things stayed, or are you always having to get the same manipulation over and over and over? Go ahead and leave a comment in the comment section below. Tell me a little bit about your story, your life, your struggles related to this video, and let me know what your experiences have been overall with chiropractic care. This has been another episode of Working Body Wednesdays. If you enjoyed this video, be sure to subscribe and hit the little bell so you never miss another video again. I try to post every Wednesday about 5 p.m. Eastern time, so be sure to check back next Wednesday. Thanks so much for stopping by, guys, and I look forward to seeing you next Wednesday.